Hi, Robert Donatus here, physio from Sandringham Sports Physio. And I'm here today with Alex, our myotherapist, and she's volunteered her knee so I can show you the most effective taping technique to relieve the most common knee problem we see coming through the clinic. So the most common problem we see is related to the tracking of the patella, called patellofemoral pain. So I'm going to show you the first of two taping techniques. This one's called diamond taping. It's a very common technique that we use to alleviate the most common knee problem that we see on a very regular basis. Let me show you how it's done. So I've marked out 4 important points around the patella, just marking superior medial and superior lateral borders of the patella. And below the patella, I've just marked out where the fat pad is. And they're important landmarks for me when I start my taping. I like to put an underwrap underneath, such as one of these Fixamol products. And if you've got a compliant patient, they can help you unwrap that as well, because we're going to wrap off 4 of these. So Alex is going to help me here. So we'll cut 4 of those. Very good. I'll take that one. And this is just an underlay, so we just lay that down, no real pressure. Lay that down there. So it's called diamond taping, and you'll see why in a moment. Good, there's 2. Great help from my patient, I'll give you the tip. There's 3, all right, running along where that fat pad is. And number 4 is right there. Thank you very much. Okay, now we can get rid of the rubbish. We'll pop that in the bin. And we are going to need 4 more small anchors. So I'll let you prepare those as I start to put the rigid tape on. So you can see I've got the knee a little bit flexed. So I've just got a small towel underneath. It tends to be a little bit more comfortable for the patient and more likely to have the tape stick. So now we're going to use some rigid tape. I'm going to just place that there and drop that down. We're going to do the same thing on this side. Place it there, drop it down. Then we're going to use one of these that Alex has prepared for us just to anchor that down to offer extra reinforcement, because there's going to be quite a bit of force here. So I'm going to grab the tape, finger pressure here to hold it, and you can see how I'm bunching the skin up. And it has an impact of just raising the patella a little bit. So it helps with its tracking. We're going to pull that down here and drop that down and smooth it off. So you can see already we've got some wrinkles. That's lifting the patella up. So the common problem is the patella is rubbing underneath in its groove. And now we're going to do the same thing from below up. 1, 2. Again, we're going to lock that off. All right. Grab the end of the tape. Not a huge amount of force, just moderate force. Lift that up, and you can see that's lifted the patella. And here's the 4th one. Ripper, lock that off there. And then we have 2 more of these just to lock this off. With many of my patients, I just put this on and leave it on for a couple of days. If they shower with a plastic bag, you can probably get 3 or 4 days out of it. If, however, they're about to go and play sport, I would do the following. Let's get rid of that. I'll ask you, Alex, to hold on to the ends of these tape and just bend your knee up a little bit for me, right? Just to stretch the tape out. Okay, and just hold your knee there. And now we're going to use this elastic tape, or some people call it a blood tape, and I'll use that just to help hold it all together. So just a figure 8 behind the knee, wrap it round. No wrinkles, Robbie, is what they usually call me. Lock that off there. A little bit more of rigid to hold that in place. So there it is, diamond taping of the knee. Helps address the most common knee problem coming through our facility, helps offload the patella joint, helps also offload the fat pad, and that's how you do it.